First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Another reminder, please take the online Learning Cum Evaluation Test exercise or OLETE for mastery of learning and have a perfect score to get a certificate like the one shown here. We have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your faces in the video. Okay. Ready, everybody? 1, 2. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses, 3 general groups of courses in the pep talk. I completed the core course on October 9, 2021. The topics of the core course are shown here. And from October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Operation Wounds, How to Take Care. The empowerment objective is for the lay people to have an essential understanding of operation wounds, how to take care in their health management. The contents of this pep talk will be the following. What are operations wounds? What are the 3 types? Okay, that will be discussed in this pep talk. What are lay people's common questions on operation wounds? Common practices on operation wounds in the Philippines, how to clean operation wounds and maintain their cleanliness at home, how to avoid infection and other complications on operations wounds, and then how to promote faster healing on operation wounds. As a disclaimer, okay, this talk, the contents of this talk will consist of my thoughts, perceptions, opinions, and recommendations of what I call TPORs, come from personal experience as well as from the experience of other experts. Let's start with the first topic. What are operations wounds? Operation wounds will be operationally defined in this pep talk as wounds that are created in the process of doing an operation where the skin is cut or incised by a surgeon, as illustrated in this picture. So a surgeon making a cut, and then there's a resultant wound. So this is an operation wound, in contrast to wound not done by surgeons. So there is a wound that is skin created by a surgeon to do a surgical procedure in the underlying deeper tissues, usually, or you can do a operation of the surface of the skin, but usually It can also be done on deeper tissues as well as in the organs below the skin, just like in the abdomen, okay, within the abdominal cavity. What are the three types of operation wounds that will be discussed in this pep talk? Operation wounds may be closed completely or partially after a surgical procedure in the underlying deeper tissues or organs, or intentionally left unclosed or open by the surgeon. So it's not all the case that the wound has to be closed. There are some instances in which the surgeons have decided for the benefit of the patient just to leave it open or partially closed. So thus there are three types of operation wounds to be discussed here. The closed wounds, as exemplified by this one, the wound is totally closed, okay, and also this one, partially closed, okay. So there are some gaping areas in the wound, okay, not totally closed, and open wounds. Okay. So the wound was left open by the surgeon with no sutures, not even one sutures was placed. Okay. So this is the open wounds, partially closed, and completely closed wounds. So common questions, what are the common questions by the lay people? At home, how to manage the operations wounds? And specifically these questions consist of the following: how to clean them and maintain their cleanliness, how to avoid infection and other complications, and how to promote faster healing. So you can add to these questions later on during the open forums. These are the more common questions that I usually encounter in my practice. Ideally, all the common questions and concerns should be asked to the surgeons who did the operation wounds. They are in the best position to answer these questions. However, a lot of times these questions are not fully addressed. That's the reason why I'm including this in my pep talk this afternoon. So what are the lay people's common practices on operation wounds in the Philippines as experienced by me? Okay. So number one, they are afraid to use tap water in cleaning operation wounds. That's the most common practice. Afraid to wet the wound. So this is corollary to this one. Okay. And then afraid to take shower, also corollary to afraid of wetting the wound. Covering the wounds for a long time than necessary. This is another common practice. Using antiseptic solution and ointments, hydrogen peroxide, guava leaves decoctions, etc. Then antibiotics, usually on their own. Taking vitamins and herbal supplement, allegedly to hasten wound healing. Afraid to move the area of the wounds despite the surgeon's advice na pwedeng galawin, pwedeng i-exercise ng a little, etc., etc. Okay, and others. Okay, so I just listed some of the common practices of lay people in the Philippines. Again, you can add some more to the discussion later on. These practices arise from myth or from traditional or cultural practices. So they arise from conflicting opinions also and practices of physicians and surgeons. We know there are a lot of conflicting opinions and advices of different surgeons and also different physicians. And then also some are influenced by pharmaceuticals marketing, especially those involving drugs like the antiseptic solution and antibiotics. Okay, so pharmaceuticals will try to market them and say that you have to use this these drugs, this ointment, these antibiotics, okay, no matter what. Okay. So I will try to give my TPOR, thoughts, perceptions, opinions, recommendations on these common issues on operation wounds using a minimalist approach. When you say minimalist approach is what is essentially needed. Okay. Not maximally approach, yung mga nice to have. Now, pwedeng hindi gawin. No? Okay. Again, disclaimer, this contains my TPORs called from personal experience and from other professionals. So 3 types of operation wounds to be discussed here. I will just limit this to these 3 types. Now, clean closed wound, partially closed wounds, open wounds. Okay, I will not include those which are grossly grossly contaminated. Okay, so these are clean and not grossly infected, and then so the surgeon decide to just leave it open. Okay. Unless otherwise instructed by the surgeon who created the operation wound. Okay, this is the first caveat. Okay, all types of wounds, whether it's closed wound, partially closed wounds, and open wounds, should be cleansed starting 24 hours after the operation. So this is an advice, okay, recommendation from yours truly, but I said unless otherwise instructed by the surgeon, you just have to follow them. Okay. So now, the fear of wetting, of cleaning the wound 24 hours after the operations, okay, arise from a myth that wounds cannot and should not be wet. Okay. But the fact is, wounds can be wet as early as 24 hours after an operation. And the mere fact that you see some surgeons also cleaning the wound with water, with normal saline solution, attests to the fact that the wounds can be wet as early as 24 hours after an operation. So corollary to this practice is that we ask, is it safe to wet all types of wounds as early as 24 hours after an operation? Yes, patients can take a shower 24 hours after an operation without fear of the wounds getting wet during the shower. But I have to emphasize, it's better to take a shower and not a bath. When you say bath, you soak yourself in the bathtub. So the bath will, the danger here is that the bath will soak the wounds while you are in the bathtub. Okay, so it's better to have a running water in the shower. Again, the myth is wounds cannot and should not be wet, but the fact is wounds can be wet as early as 24 hours after an operation. Cleaning of all types of wounds should be done with clean water. Clean water. So clean tap water or clean drinking water will be sufficiently effective or cost-effective. So you can also use cool boiled water, distilled or mineral drinking water, and saline solution will do. Saline solution means those with salt solution. Okay, so the cleaning of wounds should be done with clean water. Okay, so you don't really need to buy all those expensive cleansing agent. Okay, so the myth is that it is unsafe to use tap water for cleaning of wound. Ay, marumi yan, tap water yan, baka mag-infect. Okay, but the fact is, it is safe to use tap water in cleaning wounds. It does not lead to higher incidence of wound infection. And that's the basis for saying that it is safe to use the tap water in cleaning the wound. So the basis for this is that these authors, Fernandez and Griffith, conducted a systematic review to assess the effects of water compared with other solutions for wound cleansing. So there was a research done already on this. Most of the identified studies were comparisons of water with normal saline. So they compared a group of patients whose wounds were cleansed with water, and then those cleansed with normal saline or salt solution, and then tap water only with no cleansing, okay? With no, just tap water. So interestingly, they found that tap water was more effective than saline in reducing the infection rate in adults with acute wounds. Perhaps more surprising was there was no statistically significant difference in infection rate when the wounds were cleansed with tap water or not cleansed at all. Okay. So when you say this statement says kahit na hindi mo nilinis ng tap water, pareho lang yung results. No? But it's nice to cleanse it with just the tap water. Okay? And tap water here is better than normal saline. Kaya pwede na yung tap water. Okay. Cleaning of all types of wounds can be done with clean cotton balls or gauze soaked with clean water. So pwede na yung clean cotton balls, doesn't have to be sterile, basta clean, and then gauze also, again, yung clean tap water or yung drinking water, okay, bottled drinking water, this is the ones readily available, okay. So, but make sure that you must clean your hands before you clean the wound. Clean hands to clean. Cleaning of all types of wounds should be done at least once a day, and even more frequent as needed, especially for those with soil dressing. Okay? Yung nababasa, naso-soak yung dressing. So kailangan palitan mas often. Okay? So frequently seen in the soiled wound dressings, usually seen in partially closed wounds and open wounds. But for the completely closed wound, usually dry na siya, so you just have to clean it once a day. Cleaning of all types of wounds can be done using ordinary mild bath soap with no need for commercial cleansing solutions. So ordinary bath soaps without or with mild antiseptic or antimicrobial may be used. So the effect of the use of ordinary soaps is the same as that of commercial cleansing solutions. Ang emphasis din dito, kasi maraming sabon din, may mga antiseptic solutions. So ang recommendation, sana wala. No? Pero kung meron, just use the mild ones. No? Okay, pwede na. So one should not be using alcohol. Okay. Although we know it's a antiseptic solution, pero hindi kailangan. Okay, mahapdi. No? Okay, at usually may nadi-destroy na mga cells, alcohol, hydrogen peroxide, povidone, iodine, guava leaves decoctions, and other ointments, as they may cause irritation on the wounds and affect wound healing. So the one thing that they are against with the use of all these solutions is that they can affect wound healing. So mas maganda, just tap water or normal saline, no? Okay, which does not really cause irritation and affect wound healing. And after the cleaning, just pat dry, patuyuin lang, okay, with clean cloth or towel, or just let the wound dry by itself. So all types of wounds are initially covered with a sterile or clean gauze, kahit na clean gauze pwede, for at least 24 hours. Okay. After 24 hours, all dry wounds may not have to be covered with gauze, but have to be maintained clean all the time with clean, loose, and not tight clothes. Okay. So after 24 hours, pag yung mga close wounds, no, dry na dry, you don't have to cover it anymore, but maintain it clean. Always maintain it clean with the clean clothes. Yung mga loose lang. So all types of wounds are initially covered with a sterile or clean gauze for at least 24 hours. After 24 hours, all wet or weeping wounds, okay, still have to be covered with gauze to avoid soilage of the clothes. Okay. So yung mga nababasa na sugat because of the open wounds, partially open wounds, pwedeng lagyan pa rin ng gasa para hindi ma-soil yung damit. No? So, what are the main strategies to avoid infection of the wounds? Okay. So the main strategies are daily cleansing with clean water and shower, and cleanliness maintenance with clean clothes. Dressing may still need to be placed for weeping wounds. Okay, these are the general strategies, very simple to remember. Daily cleansing with clean water and shower, and cleanliness being maintained with clean clothes. Then dressing may still be placed for weeping wounds. Okay, meaning as needed. Pag dry wounds, pwedeng wala ng dressing. Antibiotics may be prescribed by the surgeons to avoid infection. But remember, not all wounds need antibiotics. It's either oral or topical. Then, if infection sets in, hindi ka binigyan ng antibiotics, kung wala kang antibiotics, but infection sets in, do not blame it on the, kasi walang antibiotics. The infection is because of the contamination that has occurred during the operation and how the surgeon manages the wound. Kaya kung minsan, alam ng surgeon, medyo contaminated, so they just leave the wound partially closed or leave it open. This is to avoid infection. So that's the main reasons for leaving the wound not totally closed. Okay. So may reasons for that, no? So it's more effective than giving antibiotics. So to minimize the chance of dehiscence, which is one of the complications of the operation wounds, so we try to avoid strenuous stretching and flexing activities around the wound until the wound is declared to be completely healed and safe to be moved freely. Okay, so this is an example of a dehisced wound. Okay. Now, usually the wound is completely declared to be completely healed and safe. Mga 1 month to be sure. No? Pero kung minsan 2 weeks, 10 days, pwede na. Okay? So cleanliness of the maintenance of the wounds. Okay. To avoid, this is to promote faster wound healing now. Okay. So to promote faster wound healing, one is strategies will be cleanliness, maintenance of the wounds, then rest of the wounds, and healthy natural diet are the best strategies to promote fast and faster healing. So not the food supplements or other topical medicines or concoctions or decoctions. So simply lang, cleanliness, maintenance, rest of the wounds, wag masyadong stretch na too much, no, flex too much, and then healthy natural diet. Pwede na, okay? So the other strategies would be no smoking and quit smoking, and then control your diabetes if you have. Okay. So because diabetes can affect wound healing. So summary and takeaway for this particular short talk will be, I've discussed the following: operation wounds, what are they? What are the 3 types? We mentioned about the closed wound, partially open, partially closed, or partially open, and then open wounds. And then what are the lay people common questions on operation wounds? As I said, I mentioned some. You can add some more. What are the lay people's common practices? Again, I mentioned some. I think there are more. How to clean the operation wounds and maintain their cleanliness at home. How to avoid infection and other complications on operation wounds like dehiscence, and how to promote faster healing on operation wounds. So takeaway in relation to patient empowerment: be always in touch with reliable medical information on how to take care of operation wounds. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on how to take care of operation wounds in your health management. So with that, I end my pep talk this afternoon. I hope I have empowered you to have a better understanding on operation wounds, how to take care of them in your health management. So before we go to the question and answer portion sections, Please take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this. Okay. So 50 OLETE certificates will entitle one to a free voucher for ROJoson telemedical consultation. And then again, please type in your feedback in the chat box during the open forum before we adjourn. So with that, let's have a group picture taking before we start the Q&A and interactions. Okay, everybody on board now. Let's have a good picture taking. Ready? 1, 2, 3. Okay, the floor is now open for questions, comments, and consultations if you want, okay, and other things, okay, and sharing of experience, of course. Okay. So all of you here, 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, so 9 have undergone operations and they have operation wounds as a result of the operations. Okay, can you validate what I discussed in my pep talk? Ginawa ko ba ito sa inyo at you think it has an ill effect or wala? So this is the minimalist approach, yung essential lang, yung kailangan lang, no? Yung ginawa ko sa inyo, no? Okay. Maximalist approach, bibigyan kayo maraming paraan, measures to take care of your wounds, which may end up to be the same as the minimalist approach, no? Okay. The minimalist approach, simple lang, more convenient, no? Okay. Of course, the results will be the same, no, in terms of complications, infections, and other problems, and not as costly as the maximalist approach. No? Okay. So questions, comments? Susan.
Okay. My wound from my operation is almost 3 weeks na, no?
Okay.
Almost 3 weeks. No? I noticed that because it was an operation on the left breast, so it's the left side still feels, or is it normal that the left side still feels a little heavy because the wound was there? And
yeah.
I don't, although I move the arm. I have to move the arm. Do I have to move the arm? Do I have to exercise the arm slowly or something like that?
Yeah, okay. The first question that you ask, you feel something, a little discomfort, no? Okay, after the operation, that's normal because a wound was created, there was some manipulation there, no, compared to the other parts of the body na walang ginawa. So you feel, naturally, you feel something, kung saan may soreness, no, kung saan may konting discomfort. Okay lang, but in due time, after healing will progress some more, no? All those feelings of discomfort will eventually disappear, no? Or lessen, no? Okay. Now, your other question is exercise. Yes, you have to do a little exercise kasi kung wala, titigas din yung shoulder mo, no? Okay. So do it gently, no? So how far can you reach now? Testing ko lang. Sige. Yan, pwede na. Okay? So, slowly, no? Yung iba kasi natatakot, ayaw galawin. Hanggang dyan lang.
Eh baka magkaroon ng atrophy.
Kaya nga, kung hindi lang atrophy, magkakaroon ka ng stiff shoulder. No?
Yun, mga kulay. Oo.
Okay? If you don't move it, no? Sa titigas yan. No? Okay? So,
Kasi
imumove
baka
mo.
mag-open yung wound.
Kung 3 weeks na, hindi na ano. Okay? Okay. Meron pa bang watery discharge? You told me last time.
Wala na ho.
Okay.
This past 2 weeks pa, wala na.
Okay. So those things can
So
happen.
I don't have to cover the wound anymore after taking a shower, right?
Yeah, you don't have to. You just yung coverage mo lang, yung damit mo.
Okay.
Yung damit mo lang, pwede na. Na? If you want to put a bra, pwede na rin. If you want to put a bra.
Baka masakit.
Ay, nasa iyo. It all depends on ano. Kung gusto mong may bra, yung iba, yung iba, ay, walang bra.
Okay.
Okay.
Okay, and that's about it. Thank you very much.
Okay. Thank you for sharing. So, okay. So, anybody else who wants to share their experience or validate what I've been teaching, or what I've been talking about? No? So, I usually, what do you call that? Preach what you taught, whatever, what, okay? Practice na. Okay. Anybody? So, Mary Ann, I think I operated on you more than 10 years ago na, di ba?
2008 po, Dok.
2008, 2023 na ngayon.
Yes po.
So, ilang years? 15 years?
Almost.
Okay. So, did I use the same technique, the minimalist approach in treating you?
Sorry, Doc, I attended late today, so I didn't hear. But the way we heard from Ma'am Susan, before I remember you told me to stretch right away my right arm, the one with operation.
Yeah.
So that to avoid, I think, frozen shoulder.
Yeah, frozen shoulder or stiff shoulder. No. Yeah.
Also, Doc, bali similar kayo, Doc, nung doktor ko sa Singapore sa Raffles Hospital. Yung spider run ang tawag nila.
Spider
run. Yung nasa wall ka, tataas mo yung kamay mong dahan-dahan.
Okay. Yung type of exercise. Okay. Okay.
But hanggang sa pinakamataas.
Okay.
Second day yun. After operation.
Yeah. So actually, yung mga exercise, maraming klaseng regimen na pwedeng gawin, no? Okay. So, but the simplest, again, minimalist approach, basta galawin mo yung galawin, no? Hanggang maabot mo yung full range of motion, yung full range. Yan lang, no?
Pero grabe, Doc, yung sa Singapore dahil operation ko yesterday, bali gabi, din kinabukasan, when I woke up, nandun yung doktora ko. Kinukumusta niya ako, hinawakan niya yung kaliwa kong kamay, binanat niya, sumigaw talaga ako. Ang sakit. Sabi niya, ganun talaga daw, para daw, hindi daw, yun nga, maging frozen, daw.
Okay. Anong doktora, ano yan? Surgeon o rehab?
Siya, surgeon siya, Doc. Iba yung oncologist din, surgeon Doktora
Okay. So,
sabi ko, Diyos ko, grabe. Sabi ko, mas matindi to kay Dr. ROJoson. Second day, wala bang 1 day valid ko kapag kagigising ko lang, Diyos ko. Talagang sisigaw. Sakit
hindi sinabi sa iyo na
Basta lang ako, tapos tignan ko nga yung kamay mo. Kumbaga in English kasi Chinese siya Tapos yun na nga, in-stretch talaga, sumigaw ang tinginan lahat yung mga nurse doon kasi 4 yung nurse doon na kasama niya. Bali nasa private ko bali solo ko yung kwarto. Kaya buti na lang hindi nakakahiya ako. Tagang sumigaw talaga. Ang sakit.
Okay. So,
Opo.
so dapat sinabi mo na sa iyo na ano, Mary
Opo.
Ann, I will try to stretch your arm gently. No? You just tell me how far it can go.
Kumain.
Wag yung biglaan. Okay.
Sabi, pero after po nun, talagang maginhawa, parang walang nangyari, parang hindi ako naperahan. After nun,
Okay.
wala
Yun
stiffness
pala
na.
eh. May advantage pala yun. May benefit pala yun.
Pag may mga nagtatanong nga sa akin po, yung mga bagong operated na mga, yung sister ko po, di ba, alala niyo po, si Dr. Ellie. Ganon din ang tinuro ko sa kanya. Sabi ko, banat, yung ano mo, ganyan ginawa sa akin dati.
Yeah, okay. Yeah.
Grabe. Sakit.
Tama yon, tama yon. But of course, patients and people are different. Kaya minsan, iba takot, no? Kahit na anong sabihin mo, anong advice mo, ayaw gawin, no? Okay. So we just have to adjust, no? Okay.
Totoo.
Okay. Thank you. Thank you for sharing, Mary Ann. Okay.
Thank you po din po, Doc.
Anybody else who wants to share? We still have 15 minutes. Mary, you want to share? I think si Mark.
Okay, it's more of still feeling periodically yung pain, yung may kirot. It's not about cleansing anymore, but it's yung you still feel the pain once in a while. Yung unusual na it comes and goes.
Yeah.
Is that normal? So
yeah. Normal lang yon. Normal lang yon. No? Okay. Normal lang yon because number one, as I said, there was a procedure done, no? A procedure that entails some cutting of some nerve, some muscles, di ba? Okay. So when you cut some muscles, some nerves, you have some soreness, you have some pain, no? And it will take time before this pain goes away, no? Okay. So basta hindi lang siya masakit na masakit. Number two, on and off na gradually nagle-lessen over time. No? So it's a sign of healing process is going on. No? So okay yon. Pwede na yon. No? Okay. So,
and then doctor, you mentioned yung cleansing. You mentioned shower or clean water. And then salt solution. The other one is just water without cleansing. Tama ba yung intindi ko? The third mention is water without cleansing. Just water running it through over the wound.
Yeah, yung study na ginawa, no? That research study, they compared yung tap water with ang tawag doon?
Basta clean tap water.
Yung isa, basta walang cleansing, kasi di ba when you make a study, you compare some groups, di ba? So one group na walang actually this one is not an experiment. He reviewed all the literature, yung mga published, no? So nakita niya yung mga number one arm is walang cleansing, no, whatsoever, no? Okay. Number two, yung cleansing with tap water lang, no? The other arm is cleansing with normal saline solution, no? Okay. So
there's nothing as no cleansing. Possible yun. Lalo na kung walang tubig, Doc.
Ha? Lalo
na kung walang water supply masyado.
Hindi, kasi I think
survivable.
Hindi. I can explain it this way. No? Number one, kasi a common practice, even in the Philippines, no? Okay, a lot of surgeons also tell you that wag mong buksan. Diba? Tama? Let the dressing be there, no? Hanggang umuwi ka, and then, sabihin sa'yo, bubuksan ko lang yan after when you come back. No?
Yes.
So, that I think represent that group na walang cleansing.
Okay.
Okay?
Hindi naman many days na walang linis. Hindi naman ganun.
Yeah, nga, many days na walang linis. Basta nakatakip lang.
Okay.
Nakatakip lang. Na? Okay? There are some surgeons who still practice that. Na? Okay? So, sasabihin sa iyo, huwag mo bubuksan, ako nang magbubukas. Di ba? So, babalik ka after 4 days, 5 days, 6 days. Di ba? So, ibig sabihin, hindi nalilinisan. Na? Okay? So, yun ang lumabas dun sa study na yon, no? So kahit na hindi mo nilinis ng mga anong solution, the infection is not as high as the others na in which you use some solutions, no? Okay? So that's a finding, no? Okay. Which could happen, di ba? Kasi pag clean dry wound, no, pwedeng hindi naman linisin, no? Have you experienced yung may mga surgeons na who practice na pag may sugat ka, lalagyan nila ng isang plastic na tape na transparent na, okay, nakadikit, di ba? So they will tell you, wag mong gagalawin until we see each other. Di ba? Okay, they put a plastic tape so that sabihin niya, you can take a bath, huwag ka matakot kasi plastic yan, hindi mababasa. Diba? Yan ang reason nila for putting that tape na may plastic. Na? Okay? So, may mga, up to now, may gumagawa pa doon. Ibig sabihin, they still believe na it's better not to wet it. Diba? Yan ang message nila sa mga pasyente. Na? Wag mong ibabasa, just put the plastic. You can take a bath with that plastic tape. Na? Okay? Walang problema. Na? Okay? So the other two groups of comparison is that you use tap water versus normal saline. Na? Okay. So walang difference. Di ba? So that's why they concluded that you can use tap water. Okay. Ang pinaka-the best kasi normal saline is yung solution na yun is equal to the yung mixture, yung what do you call that, yung solution is parang very friendly sa skin ng katawan, yung normal saline salt solution, na? Okay. So yan ang pinaka-ideal, na? Okay. Pero
yun, Doc. Ilang percent yun? Ilang percent?
Which one? Yung salt?
Salt solution. Oh, just wonder lang. 9%.
Usually they call it normal saline solution, no? Which you can buy in the butika, no? In the drugstore. But it entails a cost, di ba? So it's pre-mixed already, okay? So 9%, 0.9% solution, which you can, if you want sa bahay, maglagay ka ng isang tablespoonful of salt and then 1 liter of water, then boil it. Ayun, normal saline solution na yun. No? Okay? So, but you have to go through that hassle of boiling it, now preparing it. No? Okay? But sabi dito sa study, you can use tap water kasi walang difference lang naman. No? So, you can use tap water. Eh kasi because of the, kasi yung misconception ng mga tao, takot sa tap water, no? Kasi sabi kasi di ba, yung mga drinking water natin, takot na tayo sa tap water, kaya may bottled water tayo, di ba? Okay. Kaya naging uso yung bottled water kasi takot tayo sa tap water, di ba? Okay. So, if you're afraid of the tap water, you can use the bottled water. No? Okay. So, which is more readily available compared to the normal saline, which bibilin mo pa or imimix mo pa. No? Okay. So, just use bottled water if you're afraid of using the tap water, no? Okay?
Okay, Doc.
Ano ba? Okay? So, di ba anong ginawa natin sa iyo?
Plain water.
Plain water, di ba? Okay. 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 Any more? Susan.
When can we safely say that the wound is has successfully healed? Mga ilang period depend
successfully healed. Ang magandang
you can move freely, you can go out and ano ba yan yung usually, hindi lang go out, kundi do your other normal activities like cleaning the house, moving,
Okay, it all depends. Now, the most acceptable answer, it all depends. Now, okay, it all depends on the whether it's partially closed, okay, or completely closed. Now, and then number two, yung status ng ano mo, yung host resistance, na kung gaano kaganda yung healing power mo, no? Okay. So the surgeons will decide also, no? Will decide on when, no? But in general, general rule, no, is that you're talking about successful healing. Okay, mahirap ano yan. Okay, let me put it this way. Kami as surgeons, if there is no complication after 1 month, we say safe ka na, wala ka ng komplikasyon. No? After 1 month, no? Okay. But the healing is going on. Day 1 pa lang, day 2, day 3, day 4, nangyayari na yon, di ba? Okay. So usually on the 7th day, kaya nga natin tinatanggal yung tahi mo, 7 to 10 day, no? Ibig sabihin, clearly healed na yon, no? So hindi na bubuka yung sugat mo. Okay? Okay? And then you allow yourself more time to complete the healing up to, as you go on, mga 2 weeks, 3 weeks, 1 month, at 1 month, most likely the healing will be firmer, okay? So that you can freely move it already without causing dehiscence, no? Okay? Yung dehiscence means bubuka, no? Okay? Yung ano naman, yung going out, walang problema yon, diba? Going out, walang problema, diba? It's really, ang concern mo lang, baka bumuka, baka ano, diba? Okay. So, usually 1 month, no? 1 month ang gauge namin, but yung kung sa breast operation lang, sa breast operation mastectomy, usually 2 weeks pwede na, that you can, talagang you can really move it already freely, na? Okay. As I said, it all depends kung minsan, because the wound is so big, the tumor is so big that we have to close it medyo mahigpit, na? Okay. There's a higher chance of baka bumuka, di ba? Okay. Okay. So in that case, we will tell you, wait for 1 month or even more than 1 month, ganon, no? Minsan, no? Okay.
No lifting of heavy objects or anything, strenuous
Kung 1 month,
activity.
yeah. 1 month after, pwede na. Kung natatakot ka, basta gradual lang, do it gradually.
Gradual. Okay.
Gradual, no? Okay. Kung talagang gusto mo sigurista ka, di ba yun, 2 months, 3 months.
Okay. That's good. Okay. Thank you.
Okay. Sure. Okay. Mary.
I'm curious. Why leave the wound open?
Pardon?
Sabi mo, if the doctor is not sure may infection or suspicion of infection, why leave the wound open? Sabi mo, the third type of wound is open wound, right? Why leave it open?
Okay. So, if let's say, example, yung appendicitis na lang, ha? Appendicitis, ruptured na, yung pumutok na, okay? So, when we open through the abdomen, di ba? Sa tiyan, di ba? Then, we remove the appendix, yung nag-ruptured, ano? So, yung habang tinatanggal yung appendix, nako-contaminate yung sugat, di ba? Yung sugat sa abdomen, no? Kasi papasok ka sa tiyan, eh, ba? Kasi pag pumasok ka sa tiyan, isusungkit mo lang appendix, then tatanggalin mo, di ba? So in the process of removing the appendix, nako-contaminate yung wound mo. Lalo na kung pumutok na, may sabaw na, no? So mag-spill dun sa wound, no? So the wound is essentially contaminated, di ba? Okay, marumi na, medyo marumi, no? Okay? Compared to kung di siya ruptured, no? wala pang masyadong nana, we say it's a clean wound. Okay? So, kung clean wound, safe to close it entirely. Na? Okay, safe na. Okay. Pag yung mga ruptured, contaminated, it's safer to just leave it open or partially open. Na? Okay? Safer para to avoid infection. Na? Okay? Okay.
That gives you the opportunity to clean, ganun ba yun?
Hindi. The cleaning is still clean, pero the mere fact that you leave it open, that's a strategy already against infection development. Na? Okay? Compared to kung ang thinking mo, there are a lot of antibiotics that we can use. Sabi mo, we have a lot of antibiotics that we can use. Then we close it. No? Hindi siya as effective. Marami pa rin nag-i-infect. No? So the best technique is just to leave it open. No? Okay? Now, why that technique? No? Leaving it open to lessen the risk of infection. Isipin mo na lang yung ito yung analogy ko, ha? Mas madaling intindihan. Pag may pigsa ka, pigsa means an abscess. Na? Kahit saan, sa braso, sa paa, na? Okay? So pag ang gamutan sa pigsa is paputokin mo, di ba? Okay? It's either pumutok kusa or as pag pumunta ka sa surgeon, hihiwain para lumabas yung mga nana. Okay? Pag lumabas ang nana, either by the surgeon or kusang puputok, no? Napapansin nyo, mabilis gumaling. Napapansin nyo? Napansin na ba nyo that? You have experience on that? Pumutok na? Okay? So, madali nang gumaling. Tama?
Yes.
Okay? So usually yung surgeon, we don't close it. Kahit na hiniwa namin, hindi namin isasara. Okay? We leave it open, just yung mga nana makalabas. Okay? So, natural drainage. So when you leave the wound open, you try to, kasi remember yung pigsa, habang di pa pumuputok, ang sakit-sakit. Di ba? Andun yung skin naka-cover sa skin. Ang sakit-sakit, no? Ang tagal-tagal, no? Pero pag pumutok na yan, boom! Ang bilis ang ang galing nun, no? Okay? Okay?
You let it drain, but you also clean it, ganun, Doc.
Yeah. You also clean it. Kasi may nana pa no? May nana, no? Okay. But just think that's the best strategy. Why wounds are left open when it's contaminated yung talagang
lugar.
Yung masyadong heavy ang contamination or talagang may nana na, no? Okay. So just use the pigsa as an analogy, no? Okay.
Thank you, Doc.
Okay. So any more questions, comments? Thank you for all those questions which we can apply to other, diba? To other conditions. No?
Doc, pwede pong magtanong regarding hemorrhoids?
Sure.
Doc, kasi yung dati kong ka-office mate dun sa SG, inoperahan sa dun, walang surgery, as in pinabayaan lang siyang ganun, nakabukas. Self-healing daw tawag. Ganun ba talaga yun?
Hindi siya inaoperahan.
O, inoperahan niya pero hindi tinahi.
Inoperahan siya. Okay.
Oo. Ba't ganun?
Saan ginawa?
SG, dun din, Doc, sa Raffles Hospital.
Sa Singapore. Okay.
Oh, ba't
yan ang related to the question of middle class of Mary Ann. Na? Okay. So, yung puwet kasi marumi, di ba? Yung puwet marumi. So, tinanggal yung hemorrhoids, may sugat, di ba? Okay. So, kasi marumi siya, may dumadaan mga dumi, pinabayaan nila nakabukas para hindi siya mag-infect.
Ah.
That's the reason. Na? Okay? Mary, nakuha mo na? Okay?
Dok, hindi ba dito sa Pilipinas? Pag nagkukuha ka ng hemorrhoid?
Ganun din ako. Usually, hindi ko totally sinasara. Kung isasara ko man, konti lang para ano. Okay? Pero hindi totally. Kasi dumadaan yun, after the operation, dadaan yung dumi mo doon. No? So marumi, parang let it heal by itself. Na yung sinasabi mo, pinabayaan ng gumaling. Di ba?
Opo, self-healing daw yung doktor daw niya.
Tama yun, tama yun. Parang yung pigsa, you just let it heal by itself. Pag pumutok na, hindi mo isasara. No? Okay? Okay? Thank you for that question. At least na extended yung application dun sa question ni Mary. Di ba? Okay.
Dok, may isa ba akong question? Sorry pa, makulit.
Sure.
Sa suture, bakit lahat ng, di ba, inoperahan niyo ako, Dok, ng 2008, tapos sa Singapore ako 2013. Pareho, Dok, na ano, yung suture, yung tinatanggal, wala ba tayong suture na natutunaw pag sa breast?
Ano ba yung ginamit ko sa'yo?
Ano yung tinatanggal, Dok? Yung pinabalik mo ko, tapos tinanggal mo isa-isa, yung tahi. Pareho kayo sa Singapore. Sabi ko, pat wala bang natutunaw na ganito?
Meron natutunaw. Hindi, kasi 2008. Okay, ganun, dalawang ano yan. Maraming paraan how to close the wound. One is isasara mo yon using absorbable sutures. Di ba? So, wala kang tahi sa labas na itatanggal. Na? Okay? The other one is totally nasa labas. Nasa labas. Kaya tinatanggal. Na? Okay. Yung iba naman, it's a combination. Meron sa loob, then konti sa labas. Parang support lang. Okay? So, yung sa'yo, ano ba yung ginawa ko sa'yo? Marami? Sa labas?
Marami mo kayang sakit. Umisigaw nga po ako, di ba?
Marami. Kasi na mayroong 20.
Ano ko yung partial mastectomy.
Yan, partial. Kaya nga, 20, 40 stitches.
Marami po. Alala po, Dok. Tsaka yung sa ano kasi, dami kong yung lymph nodes. Kilikili nun. Kaya masakit din. Dalawa yung tinatanggalan ng suture.
Partial mastectomy ka kasi, no? Partial and axillary dissection.
Opo.
Okay.
Kaya masakit. Sabi ko, pareho nung sa Singapore, hindi rin natutunaw. Ay ko, ganun ba talaga pag sa breast?
Hindi. Ang tanong mo kasi kung meron yung mga absorbable, meron, no? So, kumisan, it depends on the surgeon making the decision, no? The decision kumisan is affected by yung wound, yung condition ng wound mo, no? Okay? Kung pwedeng isara with absorbable sutures, no? Gagawin nila, no? Yan ang pinaka-comfortable, di ba? Okay. So, ang tinatanong ko kung meron, okay, tanong natin si Mary, tanong natin si Susan, tanong natin si Ellen, tanong natin si Lordy, tanong natin si Del Rosario. Del Rosario, di kita na-operahan, di ba? Okay. So, we use ginamit natin absorbable, di ba? Tama? Absorbable sutures. Tama?
Doc, by absorbable, do you mean yung hindi na tinatanggal yung ano? Hindi na tinatanggal yung tahi. Ha? Nasa loob?
Oo. Kaya maganda yung tahi mo, di ba? Sinabi sa So,
yeah.
May 4 lang supporting sutures sa labas.
Yes.
Ganun pala yun.
Yan ang external. Yan ang tinatanggal. No? Okay. 4 lang. 2, 3. Pero the rest, kasi, di ba, yung sa mastectomy, medyo mahaba yung sugat, di ba? So, tinatahi natin sa loob, continuous, tuloy-tuloy. No? Kaya para nakadikit siya. No? Okay. So, sometimes we don't have to put the external sutures. Yung external sutures, yung nasa labas, natatanggalin. Na? Pero kung nilalagay ko, mga 4 lang, 3, 4, parang lang, extra support lang para sigurado hindi siya bubuka. Na? Okay? Pero kung 3-4 lang nakakita mo, ano yon? Sa loob, merong absorbable sutures. Absorbable means you don't have to remove it. Meron. Okay? Okay? So, Lordy, ano may ginamit ko sa'yo?
Ganun din po, Doc. Yung parang 4 lang siya or 5.
Yung tinanggaling sa labas.
Opo.
Yung sa loob, hindi mo lang nakikita, meron yun. Na, okay.
Opo.
Okay. So, Mary, ganun din sa'yo, di ba? Okay. So, Mary Ann, meron. Mary Ann.
Okay po. Thank you so much,
Okay.
Doc.
Okay. So, any more questions?
Doc, another, sorry.
Sure, no problem.
Yeah. How do we avoid keloids in the
Okay.
wound?
Mahirap. How do you avoid? Yung keloid kasi it's inherent na sa katawan ng tao, no? Some person will react, no, dun sa wound healing na with excessive tawag doon, mga scar formation. Yung iba naman wala, no? So mahirap i-predict, na unless talagang may history ka ng keloid na. Kung may history ka ng keloid, siguradong ano na. We can say that most likely magkaka-keloid ka, na. So how to avoid it? Kasi yung may keloid na, mahirap na rin gamutin eh. No? Kuminsan, nilalagay nilang steroids, ini-injectionan, pero kadalasan wala ring effect. No? So most of the time, we ended up na parang ano lang, just let it be na lang. No? Just hope and pray, hindi lang siya lalaki, hindi siya gagapang sa malayo. No? Ganon. No? Okay. So ganun lang yon, no? May keloid ba? May keloid ka ba, Susan?
Hindi ko pa tinitignan.
Hindi, wala ka namang history, di ba? So most likely wala.
Mukhang wala kasi nagkaroon na rin ako ng major operation sa, well, yung thyroid cancer. Ni walang nakakapansin na na-opera ako sa thyroid.
Yeah, okay.
Okay.
Sige. So it's unpredictable kung sino magkaka-keloid. Sana hindi. No?
Parang, Doc, depende yata sa skin yun. Kasi yung, Doc, if you still remember, dati umuwi ako dito, nagpa-opera ako sa inyo nung pinatanggal ko yung nunal ko sa likod. Nagkaroon siya ng keloid. Depende yata sa skin eh.
Hindi, okay. You have to differentiate yung keloid from hypertrophic scar. Yung may mga tinatawag hypertrophic scar, yung makapal lang, no? Yung keloid gumagapang, no?
Yun ba yun? Kasi parang sa akin na-emboss siya.
Yung medyo nakaangat, na makapal siya, yung tawag na hypertrophic scar, no? Hypertrophic scar. Okay, okay lang yun, hindi siya masyadong maselan compared to the keloid. No? Okay. So yung keloid is nakikita niyo itong drawing ko?
Yes.
Okay. Pag ito yung sugat mo, pag keloid siya, yan, gagapang siya dito, no? Okay, makapal, no? Pag hypertrophic scar ka, ganun lang yan, makapal lang, no? Okay. Ito yung keloid, no? Ito hypertrophic scar, makapal lang, no? Ang pinakamaganda yung the best, yung isang guhit lang, no? Yung flat na flat, no? That will be the best. Pero ito, kung makapal lang all the way, no? Okay, isang papiraso lang, no? Ganon. No? Okay, hypertrophic scar yon, no? Hanggang doon lang siya, hindi na siya lalaki, no? Minsan lilit pa. Minsan nagre-react lang yung hypertrophic scar, nagre-react doon sa tahi yung embedded yung absorbable sutures, no? Okay, kasi bago ma-absorb yung absorbable sutures niyo, yung natutunaw, magkakaroon ng reactions, no, ng katawan, so kakapal, no? Pero in due time, usually from experience, pag tumagal, lalambot na rin siya eventually, no? Pero itong keloid, ito yung wala kang control, no? Kasi nasa katawan mo na yan eh, parang destined to have keloid ka, no? Wala tayong gagawa, no? Okay. Okay?
Thank you po, Doc.
Okay. Parang may mga bakuna dati, yung smallpox, yung sa deltoid, dito, sa may braso.
Opo.
Kung sa nakikita mo, may keloid, kung sa makapal lang, no? Ganun. No? Okay. So, iba-iba. Okay? Any more? Lordy, may sasabihin ka?
Ay, Doc, may tatanong po ako.
Sure.
Yung kilala po kasi ng tita ko, yung bali yung pamangkin nun, may ano din siya, breast cancer po ata. Tapos, mas nauna sa akin na operahan yun eh. Ngayon, bumalik daw po ata, parang umakyat na sa brain.
Kumalat. Okay.
Bumalik. Pero matagal na po siya eh. Tapos ngayon, matagal na po siya na operahan. Tapos ngayon, bumalik ngayon eh. Umakyat po sa brain.
Anong tanong mo? Bakit?
Yun po, bakit po kaya nagkaganon?
Alam mo bakit? Hindi, basta kaya nga tayo may check up, di ba? Tayo, di ba? Yan ang binabantayan natin, no? Lifetime yan eh. The moment you have a breast cancer, laging there's a potential na uulit at lilipat sa ibang parting katawan, na? Okay. So, pwedeng pumunta sa brain, pumunta sa buto, pwede pumunta sa lungs, sa liver, no? Kaya usually pag during your consultation check-up sa akin, na tinatanong ko kayo kung sumasakit ba yung ulo ninyo for matagalan, 1 month, 2 months, no? Okay. So yan ang questions na tinatanong ko para to check kung meron kayong simptomas na kumalat sa brain, di ba? Kasi pag kumalat sa brain, masakit ang ulo, di ba? So tinatanong ko rin sa inyo kung masakit ang buto ninyo for 1 month, 2 months, no? Ngayon, kung positive ang sakit ninyo, suspect na tayo na sa buto, no? Okay. So ito yung mga binabantayan natin, no? Okay. So only time will tell, no? At depende dun sa ano mo, yung mga kung anong stage ka, no? Kung early stage, mas maganda ang prognosis, no? Okay. So mas maliit ang risk na pupunta sa ibang parting katawan, no? So yung kaibigan mo, baka nung na-operahan siya, ano ba yung stage niya, ano ba yung ilan ba yung kulani niya, di ba? So, alam mo ba?
Hindi ko po alam eh, kinuwento lang po sa akin.
Okay.
Tapos ikipin mo po ata siya ngayon.
Okay. So yon, lumipat sa utak na yon, no? So that's possible, no? Kaya importante yung check-up din sa atin, no? Okay. And the most important thing there is early diagnosis para maagapan. Kasi kung kahit na na-operahan, kung yung nodes mo is 10, no? Na kumalat na sa nodes mo, malaking chance na pupunta sa ibang parting katawan, no? Okay. Okay?
Thank you po.
Okay. Any more questions? Last call? Belet, any question? Belet, thank you for coming back, Belet. Tagal na tayo hindi nakita. Unmute ka. Okay. Long time no see.
Long time no see. Lagi ho napapatapat na Sabado may na pinupuntahan.
Okay lang. At least.
Ako magpapacheck up sa inyo. Lagi masasakit ng mga ganito. Pero sabi niyo dati, mag-exercise na lang. Yung masasakit ng mga buto ko dito, at saka dito sa likod, sa bewang. Nag-exercise naman ako lagi.
Okay, exercise lang. Exercise. So, di ba na-operahan ka?
Oho. Sa PGH.
Ibang nag-opera sa'yo, di ba?
Iba ho, si Dr. Gemma Uyho.
Okay, so, sige, pakishare nga experience mo. paano kang ginamot? How to take care of your wound?
Bali, parang may nakano dito nakalawit sa aking dibdib. Ano ba yun? Parang
Tubo.
may bilog ho, parang bomba.
Oo, yeah. Okay. So, lahat yung mga na-operahan ko rito may bomba.
Tapos doon ho may nalabas yung yung mga dugo. Tapos every hour ho'y sinusukat namin kung gaano karami lumalabas na
Okay. So yung gaano katagal ka sa hospital?
Madali lang ho, parang isang araw lang, 2 araw lang ho pagkatapos nun ay umuwi na ho ako.
Nung umuwi ka, pinaligo ka?
Hindi po. Hindi ho agad ako naligo.
Hindi ka naligo o bawal sa'yo maligo, sabi ni Doc?
Hindi mo na ho, wag mo daw maligo.
Yan ang sinasabi ko, iba yung practice ng ibang doktor, no? Okay, that's one. Okay. So, kailan ka naligo? After matanggal na yung tubo mo?
O pag natanggal na ho yung tubo, siguro may mga
1 week.
Hindi ko alam kung 5 days yun o 1 week. Parang ganun.
5 days to 1 week usually yun, no? Okay, that's another difference, no? So, okay. So, hindi mo nililinis every day?
Hindi. Parang nilagyan ko ng betadine. Hindi ko na matandaan ho Pero may gasa ho siya, may parang gasa. Tapos nung pag maliligo din doon, nung matanggal na ho yung nakakabit, may taklob din ho nung pag naliligo.
Okay, so pero hindi ka pinaligo until na-remove yung tube mo. So during this, let's say 5 days na sa bahay ka, nililinis mo?
Hindi naman ho.
So,
hindi ko nililinis.
So nakatakip lang? Nakatakip
nakatakip lang siya ho.
Okay, Mary, yan yung sinasabi ko. Mary, that's another practice ng mga ibang doktor.
Nakatakip lang ho, pero hindi ko nililinis.
Okay, so nakatakip lang, walang linis na. So, and then may tahi. Okay.
May tahi po, may tahi ho. Pinatanggal ko nang pumunta ho ako sa doktor, sa kay Dr. Gemma. Pinatanggal ko ho yung tahi. Konti lang naman ho yung tahing yun. Okay,
so konti lang, parang support lang, na? Okay. Okay. So ano pa? Anong binigay sa iyo? Betadine?
Betadine ho yun.
So another difference, no? Ako, tubig lang. Pwede na, no? Okay. So you compare yourself kay Belet and then the others, Susan, Phoebe, Lorly, no? Mary Ann, no? So walang betadine, walang payo sa betadine, pero it all depends on you. Baka kung minsan ayaw kayo maniwala sa akin, nag-betadine na rin kayo, natatakot, no? Okay. So, pareho lang yung result, di ba? Walang infection, di ba? Kung pareho lang yung results, pwede na yung payo ko sa inyo, di ba? Okay, pareho lang yung results saka mas convenient, mas matipid, di ba? Okay? Good. Thank you.
Doc, tatanong ko, bakit ho hanggang ngayon masakit pa rin yung aking tagiliran? Yung pinag-operahan. 5 taon na ho.
On and off? On and off?
Pag pag nagbubuhat ho ng mabigat, itimba, may tubig, masakit siya. Yung tagiliran.
Saan banda?
Din ho sa left, dito sa parteng ito. Yung garnehan.
Pag natutulog ka, wala?
Wala naman ho.
Baka na lang yan. Baka arthritis, whatever, no?
Parang laman siya yung muscle. Parang na-stretch yung aking mga dito, di kasi may pinutol na mga ugat doon sa kilikili. Yung mga dentist.
Pero matagal na, di ba?
5 years na ho yun, nung May.
So dapat nawala na yun. So, i-exercise mo na lang muna. Kung di mo wala sa exercise, na-bone scan ka na, di ba?
Matagal na ho.
Nasaan yung finding mo sa bones?
Nasend ko na ho yun sa inyo. Isesend ko ulit. Hahanapin ko.
Hindi mo matandaan kung nasa same side? Left side?
Hindi ko matandaan.
I-review mo lang. Tingnan natin. Okay. Okay. Kasi meron kang bone scan na possible meron, di ba? Okay. So, i-review natin muna. Okay. Okay. So, thank you. Thank you, Balette, for sharing.
Thank you din po.
Para ma-validate yung sinasabi ko sa inyo. No? Okay?
Thank you din po.
So, Namar, we'll call it a day. So, Lordy, may sasabihin ka ba?
Ay, wala na po.
Okay, kasi okay. So, we'll call it a day. It's 3:20. Okay. So, I hope we have discussed it fully. No? Kung meron pa kayo ibang tanong, you can always PM me or send a message to me for questions. No? Follow up. No? Okay? So next week, I'm still thinking of a topic next week. Pero it's either thyroid or some other issues. No? Okay. Okay, so we'll call it a day. Thank you for listening. No? Okay. So, bye-bye.
Thank you, Doc.
Thank you po.
Thank you so much, Doc.
You're welcome.
Doc.